All right. Well, I'm going to get the ball rolling because we have lots of great information to share. So as people come in, we are recording this webinar, which you'll be getting a little box that says you consent to be recorded. So you know that as you join. But we're going to go ahead and take off. Welcome to our webinar around our newest report around our survey that we did in partnership with Rapid, the Rapid Survey Project. We're really excited to have you guys here today. Just a few housekeeping notes. Today's webinar is being recorded. Closed captioning is available. All participants are muted. Please use the Q&A for questions. We have a full agenda, so if we can't get to your request or question during the event, we will follow up after the event if you provide an email address with your question. And all participants will get a recording of this webinar along with the material shared via email after the event has concluded. This webinar is put on by Groundwork Ohio. We are a committed, nonpartisan public policy and research advocacy organization that is celebrating our 20-year anniversary this year. This is very exciting. We have lots planned this year. We were formed in 2004, and we champion high-quality early learning and healthy development strategies from the prenatal period to age 5 that lay a strong foundation for Ohio's kids, families, and communities. We have a full agenda. We're really excited to share insights from our Family Voices Survey project. We're going to release that project report at the end of this webinar, so you guys will be the first to lay your eyes on that, which is very exciting. We're going to start kind of right now going through housekeeping things. Linan, our president of Groundwork Ohio, is going to share why and how we use family voice to inform our policy and advocacy initiatives. Then we're going to hear from Christy Carmen, who's with the Stanford Center on Early Childhood, on what is the Rapid Survey Project. Then I'm going to go through Ohio's results and how Ohio's story plays into the bigger narrative. And then we're going to go through some national comparisons with the state and a Q&A facilitated with our audience. And we're just really excited to be able to do this. And we want to, emphasize the role that you play as our partners here on this webinar today and part of our network in the work that we do in this movement to transcend Ohio's policy landscape into effective, actionable policies that work for children and families. So I'm going to turn it over to Linan, and she is going to go over why and how we use family voice.
Good afternoon, everyone. It's Linan Gutierrez. I'm the president of Groundwork Ohio. And just as a follow-up on housekeeping, for those members of the press that may be on today, we will make sure to prioritize your questions after our short presentation around the data report. So it's nice to see you this afternoon. I wanted to share a little bit about our policy framework, which is really the foundation of what we did and what drives us to continue to seek out new information, including the new survey results that we're sharing with you today. And what you see in front of you is our policy framework. This is a framework that really guides what we focus on within the scope of our mission. And all of what we do is based on data and evidence. We advance policies that change those factors on the far left-hand side, the factors being early learning and childcare, healthcare access and quality, early childhood trauma prevention, and economic stability of families. We know that based on the data, if we invest in those factors that can build a strong foundation for young children, we will get the results or the outcomes that we seek to ensure that more Ohio young children are healthy and ready to learn, which contributes to all of our shared vision. I know if you showed up today, to really make Ohio the best place to be a young child and ensure that every child has the opportunity to reach their full potential. And so if that policy framework is a framework for what we focus on, really how we do our work is shared here in our prenatal to 5-state policy agenda process. Many folks across the state, hundreds in fact, have been engaging with us as we've traveled across the state for our Groundwork Listening Tour Roadshow. And we're spending so much time in communities right now and seeking as many inputs as possible from our key stakeholder groups because we are at the beginning of the state policy agenda process. And while this process is iterative, we're always listening, seeking input. We're doing this very intentionally right now because all of our work is building up to next year's state budget. And so we are first seeking all of this input, including gathering this new data that we're looking forward to sharing with you today. And more importantly, seeking input from key stakeholders, both community leaders, families, early childhood professionals in the field who we've been just really grateful to meet in their own local communities. And as we really narrow in on what the opportunities and challenges are, we'll be then surveying our full network on early childhood priorities later this fall, evaluating those opportunities identified by all of our stakeholder groups and advocates, and finally developing and amplifying this policy agenda, which we look forward to releasing publicly in November. And of course, then implementing the policy agenda, acting on it, and our first opportunity to do so is in the next state budget, which already this summer will begin to be developed by Governor DeWine and his team. Next slide, please. So how we hold ourselves accountable to really what our mission is focused on and whether or not we're making progress on our mission work to make sure that more children are healthy and ready to learn is by investigating those factors, those 4 kind of policy pillars. And one of the ways that we really seek to do that is through both qualitative data and quantitative data. Qualitative data is really the stories and the listening that we do among all our stakeholders. And one of the unique audiences we've been intentionally building over the past couple of years are our families. Those experts, they are the experts of their own lives. They are the experts of their young children's lives. And we have been doing a lot of work to better seek out their voice and amplify their voice so that they are viewed as an asset at the policy and decision-making table. So they have more opportunities to engage with state policymakers. And so that they really have control over the outcomes and seek more control over the outcomes of the children that they're caring for. So I would just invite you to visit our website, learn more about how we're engaging family voices, particularly through our Family Action Network. So we are seeking and building relationships with individual family members, collecting their stories, learning from them, seeking their advice and expertise as part of our policy agenda setting process ongoing. We also really look to quantitative data, and I think that many of you are familiar with our 2023 Early Childhood Dashboard. We're looking forward to recreating this and publishing this in January of 2025, right in time before the state budget yet again. And as a complement to those individual family stories we're seeking with Ohio parents and caregivers across the state, our early childhood dashboard really informs whether we're making progress on our mission, how young children are experiencing our early childhood systems, whether those systems are meeting their needs, and whether outcomes are ultimately being changed over time. And so this quantitative data has been a guiding force for our work across the organization. As you can see, when we have these individual family stories and more individual relationships with our families, and then we also have this high level, population level data on health and education, kind of access and outcome metrics, one thing we had identified that we're missing to help close that gap is more regular feedback from a broader audience of Ohio parents so that we could really close the gap and make sure we were focused on the right things, the right priorities, and get a larger snapshot of what was happening with Ohio families by narrowing the gap between that individual family level relationship and story and our population level metrics. And that really leads us to our relationship with Rapid, which Troy's going to follow up more on. But I just want to tee up that we first became aware of the Rapid project in March of 2020. They were set up in a really unique time as the pandemic was beginning. And us as advocates were wondering, where are the babies? What's happening with the young children? And particularly when they weren't showing up to their regular scheduled programming, whether it's because of closures, health and safety concerns, and certainly other dynamics that we all experienced throughout those early months, they were really created a strategy around seeking direct input from parents to understand what was happening with those very young children under the age of 6 across the country. And so immediately our Ohio team was like, I wonder how we could get that for Ohio. And the RAPID project has really been able to now match this community level or state level data. And we were glad to be on the forefront of that as one of the first states to be able to bring this unique tool to our advocacy work, to the early childhood movement in Ohio. So before Troy begins to share more about that, there are 2 things that really make this possible, and they owe 2 big thank yous. The first is a thank you to our partners. So we were able to execute the survey in the state along with RAPID's expertise because our partners that are part of our early childhood movement across the state have very trusted relationships with hundreds and thousands of parents and caregivers across the state. And it's through those relationships that we're able to solicit this feedback as a trusted partner and knowledge broker, translating this information and their experience to a larger audience. And it may go without saying, but it's very important that we thank the many parents and caregivers themselves as individuals who generously provided us with their time and expertise and have continued to do so as eager experts to contribute to this work. Troy, take it away.
Thank you, Linan. And like Linan started to say, RAPID has been an exciting partner in this work as we consider how not only do we gather information on children and families and what things look like in their day-to-day lives, but also how do we co-create knowledge with them. Not only are we collecting information on families, we're collecting information with families. We are not just looking at what do the numbers say on a page, we're also interested on what do our families have to say and how can that help us better understand on what they need. RAPID is, we have Christy Carmen here with us today, and I'm going to introduce her here in just a minute, and she's going to talk more about the RAPID survey project, but just a little bit of a preview. They're a national initiative that have surveyed professionals and families all over, and we are really excited to get in on the Ohio side to be able to look at what do our families have to say here in Ohio, what is Ohio's story? Chrissy's going to talk a little bit more about this, but RAPID looks at things like child well-being, material hardship, childcare, healthcare, overall well-being, and we are excited to be able to partner with them to provide what I think is a really exciting report that gives us a look at what do the day-to-day lives look like for children and families here in Ohio. We also really appreciate, like Linan said earlier, all of our partners on here today, whether you're a family member or an organization or professional who helped us share this survey, we couldn't do it without you. You're an integral part in us being able to complete this project. We are excited to be able to provide a $5 survey reward or to pay our participants for being able to support. And not that $5 necessarily is life-changing, but I think it, like Linan mentioned earlier, it's important that we show that we put value to the expertise that parents are able to provide us, and that their expertise is some of the most important expertise that we'll have in this work. So with that, we're excited to have Christy Carmen here with us with the RAPID Survey Project. Christy is the director of the RAPID Survey Project based out of the Stanford Center on Early Childhood. Christy leads the research team that administrates national and place-based surveys designed to better understand the experiences, challenges, and resiliency of young children and the importance in adults in their life. The RAPID project includes 2 national surveys, one of households with young children and one of early care and education providers, as well as a statewide survey of parents in California, and numerous community-based surveys and partnerships across the U.S. Christy, we're super excited to have you here today, and I'm going to turn it over to you.
Thank you so much, Troy. Next slide when you can. And I will just dive right into a little bit more, as Troy mentioned, about what RAPID is and how we operate and partner. But I wanted to begin by saying what a privilege it's been to work with Troy, Linan, and their team at Groundwork Ohio, and to be a part of the work that they're doing and their vision for supporting Ohio's families and youngest children, and by extension, to be connected to you all here today and your partnership with Groundwork Ohio. Thank you for welcoming me. And with that, I'll just share a little bit more about what we do. As Troy mentioned, RAPID's a program of national, state, and local surveys that are designed to understand the experiences of families with children under the age of 6. And our mission with this survey project is to provide ongoing, timely, and actionable data to those who can use it to support all children and families to thrive. And as Lynn mentioned a few moments ago, Rapid launched during the pandemic. Our first survey was fielded in April of 2020. And at that time, as I'm sure many of us recall, we were experiencing unprecedented disruptions. Parents were having disruptions in their ability to work, access to those essential services and supports, and experiencing new sources of stress and uncertainty given the COVID-19 pandemic. So Rapid was envisioned as a tool to quickly gather insights and essential information from parents and caregivers about what they were experiencing and what supports they needed in order to use this as a platform to elevate that data and what we're hearing and learning from parents, so that decision makers had timely and actionable information they could use to mitigate those impacts and challenges and provide those necessary supports and services. So after about a year of gathering information from parents, we added a parallel national survey of childcare providers in 2021. And I think the rationale there was that we were really learning through the pandemic, something that we had all intuited or known in other pockets here and there, just how interconnected the lives of all caregivers are, those who are providing care outside of the home and those who are providing care for young children in their home. Our fates were really intertwined, and our ability to support children are really linked. So with the 2 national surveys of caregivers of young children, we're able to create this fuller picture of the context in which young children are developing. So some of the contexts that we use the survey to understand are parents' experiences of material hardship and economic well-being, as well as providers, adults' emotional well-being, and what they're seeing in the well-being of the young children that they care for, their access to important preventive health care, and their use of any non-parental childcare. And among providers, we really hone in on the well-being of the adults who are caring for young children. So less about how programs are operating or how they're administering their care, but really about the individuals who are caring for young children. So a little bit about how we operate. So both Rapid national surveys are online questionnaires that can be taken in English or Spanish using any device that's connected to the internet. And they're ongoing monthly surveys, again, to continue to kind of provide that timely ongoing information about what we're hearing from caregivers of young children. All participants are paid for their time. And we gather both quantitative and qualitative data, to Lynn-Ann's earlier comments about the importance of really listening to families. So we have data like the % of parents of young children who report experiencing economic hardship nationally, as well as qualitative data, this opportunity for caregivers to say a bit more and provide more rich detail about what their families are experiencing. And to date, we've received hundreds of thousands of responses to open-ended questions, which tell us that caregivers are eager to be heard and very willing to share their experiences and provide more rich context about those experiences, and really uplifts Lynn-Ann's earlier point about the expertise that families themselves hold. They're really willing to share what's working, what's helping, what more they need, and what they're seeing in their communities and their households. You'll see sprinkled in my slides later on when we get into the data, some examples of those parent voices. So as the pandemic evolved from 2020 and 2022, we continued to gather these timely, ongoing insights on an ongoing basis. But we were also hearing, as Lynn-Ann mentioned, about the need for more localized data. And we were exploring the opportunity to leverage the expertise we were building and this platform and resources that we were building to listen to families nationally, and learning about how we can adapt that in local context to meet local data needs. And so over the last few years, we've started exploring this through community-based partnerships and statewide partnerships like our work with Groundwork Ohio. And we're really eager to continue to learn how we can leverage all that we've learned and the resources that we have to bring to communities and to organizations like Groundwork Ohio to continue to use this information and these voices directly from families and parents and caregivers to drive local decision-making. So next slide. I'll just say a quick couple words more about how we do what we do. So we're really learning more about how we can adapt our tools, and we really prioritize flexibility in our research. So a rapid survey is never going to be a fixed thing that will be unchangeable. from survey to survey or context to context. We're really learning about how we can, with each survey that's fielded, adapt the questions so that we're always taking in the most relevant and meaningful and actionable information. And so that's what we've been doing with Groundwork Ohio is co-creating those surveys, including building new survey questions and adapting others. We can translate the survey into other different languages, and we can customize the data collection and analysis plan to meet our partners' needs. And that is the context that we bring to our partnership with Groundwork Ohio and the work that we've done to date, including the build up to this first report that we're eager to share. The next slide, please. I just wanted to say a quick word that RAPID has been guided since the beginning by this wonderful group of experts since the earliest days of the pandemic. And they continue to guide our work and advise us in our national, state, and local partnerships to date. So with that, I'll turn it back to you.
Thank you, Christy. So now drum roll to some of the most exciting things that we're able to talk about today, and that is the data. What did we hear from families across the state? So as Linnea mentioned earlier in our policy framework, our 4 core policy pillars are early learning and childcare, healthcare access and quality, early childhood trauma prevention, and economic stability. And these 4 pillars really help uplift our work as we think and consider the well-being of children and families. And you'll see that theme throughout our report as we report our dating findings within these 4 pillars. So who took the survey? We had 755 parents and caregivers who were able to provide us their input and voices from across the state. That covered 932 individual children that we looked as we looked at our data analysis. The majority of respondents were women, with only 25% of respondents being men. In addition, the majority of children lived in a 2-parent household, with only 25% living in single-parent households. As we look at our race and ethnicity data, we saw 66% of our respondents who identified as white, 22% that identified as Black, 7% that identified as Hispanic, and 5% that identified as something not listed on there. Also, as we look at social economic status, we see the majority of our respondents, 43%, falling under 200% of the federal poverty level, but we also see 32% of our respondents between 200 and 400% of the federal poverty level, and 25% who were over 400% of the federal poverty level. As we look at individual children, we saw the majority of households having 2 children, with 302 individual caregivers that had 2 children. 248 had 1 child, and 185 had more than 3 children. Also, as we look at parental education level, we can see below here that the majority of our respondents had a bachelor's degree, 20% had a postgraduate degree, 14% had an associate's degree, 14% had some college, and 18% had high school completion or less. We also divided our state into regions that we looked at, and we will continue to evaluate as we release more information over the summer with different reports and analysis. And you can see laid out here, we had 26% of our respondents resided in Central Ohio, 13% resided in West Central Ohio, 20% resided in Northeast Ohio, 8% were in Northwest Ohio, 15% were in Southwest, and 18% resided in the 32 Appalachian counties in Ohio. So now that we've looked at who and where our respondents come from, it's important that we center what we found in the narrative as we dove into the statistics and the analysis. And when we looked at the data, when we looked at what parents were saying, a strong through line came through, and that was that parenting is difficult. It's hard to be a parent, and Ohio's families are experiencing stress as they're navigating complex barriers and systems that support not only their children, but also themselves. We also saw that these barriers limited access to quality healthcare and early learning experiences that their children needed, children who have increasing unmet behavioral and developmental needs. We also saw that financial hardship exacerbated these barriers and challenges and created additional issues for parents to access the services that they need for their children to thrive. So, as I said before, we divided our work into 4 of our core policy pillars, and we're first going to look at early learning and childcare. And when we look at early learning and childcare, we saw almost 60% of respondents felt that their current childcare was not affordable. So childcare subsidies are a critical support for working families, but our access is limited. In addition to the 60% of respondents that felt like their care was not affordable, 1 out of every 3 respondents reported difficulty in finding childcare. Almost 60% of respondents reported relying on childcare publicly funded subsidies, and more than 40% of parents reported difficulty in finding a provider who accepted publicly funded subsidies. You know, one of the great things that we were able to do with this report is we were able to, in our survey, get extended response questions. So not only were we asking parents about specific things, we're able to hear from them in their own words. And as you can see here, a lot of parents in Ohio aren't able to return to work because they can't find care that meets their needs. In addition to early learning and childcare, we looked at healthcare access and quality, and we found that nearly 1 in 5 parents reported missing a well-child checkup within the past year. And in addition to those 1 in 5 parents, some of the most common reasons that parents weren't able to get their children to their well checkup visits were the inability to get time off work, with 48% of respondents reporting time off work as a challenge, and 41% talking about the cost of healthcare. As you can see, access to affordable healthcare and medical resources is crucial and important for families, as we see our families saying that is some of the most important supports that are helping their family the most right now. We also saw that regardless of income, that almost 20% of parents reported that their child was not able to get timely care when they were sick, and even more parents reported not having timely access to a specialist. And when I say regardless of income, it's not just families who do or don't have access to good medical insurance or benefits. That is also a challenge, but we're also seeing an access issue here in the state, as regardless of income, almost 1 in 5 respondents having challenges finding access to care when their child is sick or a specialist. Another area that we looked at was early childhood trauma prevention. And not just did we look at the wellness of the child, we also looked at the well-being of the parent. And here we see nearly 3 in 4 respondents express concerns about internal, and we say internal, we're looking at fear and anxiety, or external signs, fussiness, or defiance of emotional distress in their child. So the majority of parents express some concerns about internal or external signs of emotional distress in their child. So parents they need support for their children. And again, just like we talked about in healthcare, we see here that regardless of income, the majority of parents are expressing concern for their children. We also see that 40% of respondents reported that they had concerns about their child's development, and 60%, over half, expressed concerns with their child's behavior. So our parents and families are expressing concerns in unmet needs for their children that we need to address as a state. We also looked at parental well-being. And in parental well-being, we see that more than 1 in 3 respondents reported that they are currently receiving help from a mental health professional. So over 33% of parents were expressing that they already are in need and currently receiving help from a mental health professional. Again, like I said earlier, parenting is hard, and stress that our parents are experiencing make it more challenging. We see that in addition to parents who are receiving support, more than 1 in 3 respondents reported high levels of stress, and 65% said they could benefit from additional resources and support for parenting. I do want to note here at the bottom as well that we also saw that 95% of our parents reported having a social support system. Our families and our parents have social support systems, which is a great thing. They listed partners, friends, and parents as individuals and support systems that they could rely on. But something that I want to point out is even with this support system, even with most of our parents saying they have some social support system, we're still seeing challenges in in access to care. We're still seeing challenges in concerns of stress. We're still seeing disparities and access issues all across our 4 core policy pillars, even with the amount of social supports that our parents have. And as we think about economic stability, we see most parents are working. 95% and 20% reported working more than one job. Out of those respondents, of most parents who are respondents who are working, and 20% who reported working more than one job, more single parents reported working more than one job, 27% compared to 70% of 2-parent households. So our single parent households are experiencing additional stress and needing to manage care or additional work outside of a single job. We also see that public assistance programs are important for parents, as we see enrollment at Medicaid at 27%, SNAP at 16%, and 13% of our respondents receiving WIC as a public assistance. And you see from this parent quote here that one of the biggest challenges is managing the rising cost of living due to inflation. It can be tough to balance a budget between things like food, housing, utilities, and the prices continue to rise. So our parents are navigating an already difficult system. We're seeing our families who a large percentage are relying on external or out of the home care that you'll see in our report. Those parents who are looking for care are having access and difficulty finding care. The families that are having access and difficulty finding care, when you do find it, it's hard to afford it. And we see childcare affordability being one of the top issues where parents are not seeking care or they're not able to find care that meets their needs. In addition to navigating the cost and accessibility of care, we also see families that are showing concern about their children's emotional distress and their behavior. They're showing a need for additional supports in those areas. And we also see healthcare disparities where our parents are missing critical preventative well-child visits because they have to work or because they can't afford the cost of care. And with our families having to especially the majority, a large percentage of our single parent households having to work multiple jobs just to be able to make ends meet and navigate the difficulties for affording the things that they need. So with that being said, that was just a snapshot. That was just a highlight of what we see across our survey. Those were the key highlights. The link to the report is included in the chat. There's also going to be a QR code at the end of the webinar that you can link to the chat. You're also going to get an email. But those are the high level look of what's the narrative, what's this Ohio story that we're seeing here in the data. And now we're going to turn it over to Christy to talk about what are we seeing at the national level and how does Ohio play into that.
Thanks, Troy. So I'm going to start just as Troy did on childcare. It's top of mind for most parents of young children, and we've been hearing that it has been since the very beginning of the pandemic. Our rapid data show that parents have returned since the pandemic on relying on non-parental caregiving support over the last couple of years. So with the proportion of parents, a high proportion of parents reporting that they use parent-only care early on in the pandemic, that gray line dipping way down over time over the last few years in particular, and it's been below 20% of parents since mid-2022. So we're seeing a return to other types of support for childcare during the day. Most recently, 43% of families with young children reported relying on care provided in center settings, which is this green line here. And we're also seeing that over time, there's been a steady increase in the proportion of families who are reporting non-center-based care over time as well, which is this yellow line. And in rapid, this refers to family, friend, and neighbor care, both paid and unpaid, as well as home-based childcare and babysitters and nannies. So any kind of non-center-based care, we're seeing that is actually emerging as the most common form of care among parents who are relying on non-parental care, with 47% of parents in rapid letting us know they're using non-center-based care. So as Troy noted, with so many parents relying on care, whether it's in centers or non-center-based settings, it's really essential that the care is available to families, that it's affordable, accessible, and that it supports their families and their children's needs. One parent in South Dakota shared, there's a serious childcare crisis in our country. And it's because we're making it difficult for families to live on one income, and families need childcare but can't find affordable childcare. So it really echoes the experience in Ohio as well around how interconnected the care and availability and affordability of care is to parents' ability to work and continue to sustain their family's economic well-being. Next slide. So we also have been tracking since early days of the pandemic, access to preventive well child and well baby visits. We know that these are important visits for making sure that children are on track developmentally, that parents have their questions and concerns addressed, and that they can have access to sources of support and resources to continue to support their child's development, as well as routine and recommended vaccines. So as Troy shared, in Ohio, 1 in 5 parents reported missing a well child checkup over the past year. In Rapid, we were seeing very high rates of missed visits during the pandemic. And I think this really was very closely connected to access to doctors' offices and concern about exposure to other viruses and diseases while in healthcare settings. But fortunately, in the national data, we've seen a promising return to preventive healthcare. Less than 4% of parents reported missing a well baby or well child checkup. That's that yellow line. And less than about 1% of parents nationally reported missing a recommended or routine vaccine for their children under age 6. So this is the national data, and we've also been listening to parents and their experiences of where they're turning to for support and advice about their children's development. And we're hearing that parents are really relying on and trusting in their child's pediatrician above and beyond other types of support and advice about their child's development. So we know that this connection to the pediatrician, its access to preventive health care and these related services and support they receive in those settings is extremely important to parents. And it's essential that we continue to see these rates of access to and use of preventive health care increase for children under age 6. There are a couple of quotes to that end here in the margin, and including one parent from Ohio as well as a parent in California that really get to just how important these visits are for families with young children. Next slide. So we've also been asking over time, one of our main focus areas is how parents tell us they're doing in terms of their emotional well-being. And we ask this both about parents and their own experience, as well as what they're seeing in their own children, just as Troy shared earlier. So for adults, emotional well-being is assessed through their self-report of their experiences of symptoms of emotional distress like depression, anxiety, loneliness, and stress. And we've been seeing really high levels of emotional distress among parents of young children during the pandemic, but also beyond, even as the specific pandemic level contexts have receded. As Troy mentioned earlier, parenting is hard, especially in resource-constrained circumstances. 67% of parents of young children in Rapid are telling us that they're experiencing high levels of emotional distress, these symptoms and signs of emotional distress. So nearly 7 out of 10 parents of children under the age of 6 nationally. We also asked them about what they're seeing in their young children, and parents are reporting to us higher than expected levels of fussiness, so those externalizing symptoms of emotional distress in their children, as well as higher than expected rates of anxiety and fearfulness or internalizing symptoms of emotional distress in their young children. So this chart shows the dots on the far left side of the chart are parents' reports from before the pandemic, and this is over time. And we really see that these reports of emotional distress among young children haven't changed dramatically as over time, that parents continue to see concerning signs about these behaviors and concerns about emotional distress in their young children pretty steadily over time. And this is echoed in the data that Troy shared from Ohio parents as well. One parent in Alabama shared with Rapid about their own experiences of emotional distress, that it's been extremely difficult juggling all of my responsibilities at this time. And I feel like it's taking a toll on me physically. I feel very worn out and exhausted, as I'm sure everyone does anymore. Everything feels like a challenge, the juggling act. And I think that really gets to some of what Troy shared earlier about just how much parents are holding and carrying and the support that could really make a difference in many lives of parents of young children and in their households. Next slide. Lastly, I will just touch on what we're seeing in terms of what parents are sharing about their household's economic well-being. Hardship is defined by RAPID as the experience of difficulty paying for at least one area of basic need. So basic needs are defined as just the very basics: housing, food, utilities, childcare, which supports ability to work, as well as support for well-being and healthcare. And so when we ask parents about experiencing any difficulty in any of these areas, they're really assessing their ability to meet these very basic needs. And overall, we're seeing very high rates of hardship nationally in our data, and it's increased over time, actually. There was one period of about 6 months, you can see in the middle of this chart where the yellow line dips down, about 6 months in 2021, where the rate of hardship fell to the lowest we had seen in the RAPID data. And even then, it was hovering at about 25% of families reporting material hardship in at least one area. So still a quarter, 1 in 4 families at its lowest rate, telling us that they were experiencing difficulty paying for at least one of these areas of basic need. But most recently, we're seeing that 34% of households are experiencing hardship. So more than 1 in 3 families with children under the age of 6 are experiencing difficulty paying for their housing, food, utilities, keeping the lights and water running, and their ability to access childcare and other necessary sources of support and healthcare. So we've also found in our RAPID data and the analysis we've done over the years, a relationship between the experiences of material hardship and emotional distress among members of the household. And we've called this the hardship chain reaction. What it describes and what the data shows is that when parents are experiencing material hardship, they're also more likely to tell us that they're experiencing high levels of emotional distress. And that over time, those same parents are also more likely to report seeing signs of emotional distress among their young children. So this chain reaction shows us, and it's borne out in the data, something that's very intuitive. When you're feeling stressed and when your household is feeling stressed and having a difficult time making ends meet, we carry that into our relationships and into our caregiving and into our work. And that can undermine the supportive, attentive, nurturing care environments that we want for all our children to be able to have that supportive, nurturing experience in their development, and that those environments that support healthy development. So this really gets to the heart of how important it is to continue to find ways to support families with young children to thrive economically and in terms of their emotional well-being. And our data really point, and I think the data from Ohio point to just how essential services and supports, access to caregiving, social support, and preventive healthcare and resources are to supporting that nurturing, caring environment for adults in the lives of young children, and to the supportive environment that they want to provide for their young children. So with that, I'll turn it back to you, Troy.
Thank you, Christy. And I saw a question in the chat that I answered, but we'll talk a little bit overall about our plan for the future. We do have the ability to, and we are going to do additional analysis on this data. This report that you're getting today is an overview of the state. It's an overview of all of our respondents. We have additional reports that we're going to release out throughout the summer and fall. We're going to do a deeper dive and a deeper look at specific things, things including things like race, disability, type of childcare, income. We have lots of abilities, and that's what's so exciting about our partnership with RAPID, is ability to be able to look at so many different things and understand individual stories for each Ohioan, and how can we use that to inform our policy work here in the state. So with that being said, we are a little bit ahead of schedule, which is great because that means we have more time for questions. If you have a question, please go ahead and put it in the chat. I see Linnea coming off camera. Linnea, do you have anything you wanted to add?
No, I just want to make sure if there are questions from press, we prioritize that, but we also placed the press release alongside the full report in the chat. Obviously, we've given you a lot to chew on, and so we just invite you to explore the report, explore the data as we continue to do so. As Troy mentioned, in the coming months, we have a lot of ability to disaggregate data. And one thing that's really helpful about RAPID, in addition to being able to compare ourselves to the national context, is also the flexibility it provides to customize our questions and be curious in deeper ways as we consider the draw that we do further out into the future yet this year.
Christy, I have a question for you, if that's okay. I would love to hear, and our attendees today hear about this process and how it looked like in Ohio comparative to your other surveys that you've done. What was unique about Ohio in the process of working in our state?
Oh, it's such a good question, and I could spend a lot of time on this, but we have a variety of different partnerships with community-based organizations as well as a couple of statewide initiatives similar to in Ohio. And one thing that's really unique about Groundwork Ohio is your 4 pillars that you shared early on in the presentation are very well aligned to the areas that Rapid is focused on. So just that's not an essential ingredient to partnering with us, but it's a really nice kind of moment in which our alignment really kind of is supportive of a lot of rich ongoing work. And so I'm excited about that. And another thing that's really unique to the work that you're doing is relative to some of our other partners who are taking in data from parents into their data systems to populate dashboards and complement other data collection efforts, or to learn and kind of internally to drive internal decision making about the funding or grants that they might make or programs they might design. Groundwork is really focused on sharing this data out publicly and externally through this report that you've just published today. And so this is an exciting opportunity to learn more about how organizations like yours are lifting up parent voices and families' experiences so directly and publicly. And we're just really excited to see that not only were you able to do that in such a short time, you've just partnered since the beginning of this year, but also to continue to be able to watch and see the impact that it'll have here in the state of Ohio.
Great, thank you, Christy. And I don't see any questions yet in our Q&A. I have some additional questions for you, if you don't mind following up as we think about how this fits into the bigger picture. Was there anything surprising about Ohio's results? Was there anything that stood out or varied from other states?
I was surprised to see the healthcare visits, the missed healthcare visits as high as they were, in part because we have done some thinking about this on Rapid and about how that very low rate that we've been seeing nationally of missed visits. And that is just, it's an interesting thing because on the one hand, that promising sign that I mentioned of the return to healthcare visits and preventive healthcare for babies and young children almost like sort of stirs in me like, what else could we be using that space for? Something more timely or relevant, since that rate of missed healthcare visits has shrunk so much over the last few years. And because we always want to be thinking about what we can learn through the survey that's as relevant and timely. And this is a real nudge and surprise for me to like, it's still an important area that we need to be attentive to continue to track and understand what the barriers to those visits are. Because we know that the experience for each family can vary from month to month or year to year. And so that was really an interesting surprise to see that the variation between what we're seeing nationally and in Ohio, and a nudge to me to continue to think about how we can monitor that and understand those experiences.
Great. Thank you, Christy. We have a question in the chat. When analyzing disaggregation disparities in the future, will that be compared against the national data as well? So Christy, if you want to talk about our ability to compare national data and kind of the pros and cons that we experience when deciding questions, and I can take it from there.
Sure, absolutely. So we are able to, any questions that we are asking in our national survey and asking in the same format in Ohio, we can have the ability to compare. So with the conversations with all partners, including Groundwork Ohio, is what might be gained from keeping the question as is in terms of being able to compare to the national data versus what might be gained in adapting it and making it more specific to the Ohio context, which might compromise the ability to compare it to the national survey accurately. And so that we bring that kind of discussion into each of our conversations where we're co-creating the survey questions with Groundwork Ohio, and really leave it to you to drive what that trade-off, how you land on that trade-off, and what your priority is there.
Yeah, so just to expand upon what Christy said, one of the exciting things about using Rapid is our ability to compare nationally, but it's also our ability to customize and really be able to navigate and use questions that fit what we know works in Ohio. Ohio looks really different than California or Michigan, which are other states that you have utilized this tool in. And with us doing ongoing surveys, we can even adapt in time to what's happening in the state. If a new policy gets implemented or if there's a change at the state level, we're able to react with that with different questions and get answers relatively quickly. And when we say rapid, we really mean rapid. We were able to do this whole process in a very short period of time. So to be able to, from beginning to end, to be able to analyze that data, find those key findings, get a report out, and be able to actually now use it and educate and use it in our community and with policymakers, that ability is so unique and exciting. And it's one of the reasons we chose to partner with the Rapid project. But that does come with pros and cons, like Christy said. When we choose a question that's unique to Ohio, it's hard to make that national comparison. But we worked as a team to decide in what areas was national comparison more useful and what areas was a more unique, fresh take in the state more useful. Thank you for your question.
I wanted to follow up because the attendee is asking a really important question about racially disaggregated data. And I think another important learning from so much of our data work, including in our early childhood data dashboard, where we look at almost 70 different metrics, is how many limitations we have in our state agency and national data sets, particularly with regard to race, ethnicity, and being able to thoughtfully tell those narratives with quantitative data. And so I think one of the things we're really looking forward to, that while it is rapid, relatively speaking, requires more analysis and thought around the narrative and the takeaways that we share alongside our partners, is that racially disaggregated data to understand the unique impact of race and ethnicity as it corresponds and influences socioeconomic status, but also plays as an independent factor, which has guided us in our previous race and equity work. So appreciate that question, and we're eager to get to that next phase as well.
Thank you, Lynn. Another question in the chat asked, what did we do to make sure that these 755 responding parents and caregivers form a representative sample of all the parents and caregivers in Ohio? That is a great answer. And that's why we looked at our regions to make sure that we had representative respondents across the state. Additionally, we were able to in the future target more specifically where we need to do that recruitment. So this is the first time we did this survey, and we were very fortunate to have so many great partners on this call and that participated in this project to get this survey out into to families and caregivers that we wanted to hear from. Organizations like the Ohio Head Start Association. We worked with a lot of Franklin County Board of DDs, a lot of Board of DDs, and they were able to push this survey out. And now that we have our data from this survey, we're able to see in what areas are we able to recruit more, and what areas do we want to hear more from, and continue to evolve as a survey process. But we really worked with our recruitment partners across the state to make sure that we were getting in Appalachia, Ohio, and in other places other than just central Ohio. Christy, you had said something earlier too that I wanted to follow up on, and it was this ability to just in real time follow up and understand. So you had mentioned your surprise around the well visits, and I think as we think about our next survey and how can we respond in real time to meet the needs, in what ways have you seen this in other states be an advantage to be able to change? Not just change questions and follow up with a lot of the same people who responded earlier, but in what ways is this an effective strategy in understanding the needs of children and families?
One example that's just the clearest example, but there are many others, is that when the child tax credit, the expanded monthly child tax credit payments were being sent to families with children up through age 17, in 2021, we were able to anticipate that that resource was going to be provided, and started introducing questions to our monthly national surveys asking about, have you heard about this expanded child tax credit payment, and what do you expect in terms of how it'll impact your family's budget? And then when the tax credit started being received by families on a monthly basis, we were then able to ask, how are you using this extra income? How are you noticing it showing up in your family's household budget? And then again, as it was sunsetted after 6 months, we were able to ask, what impact has no longer receiving this monthly payment had for your family and your family's economic circumstances? And then with all of the 6-month data, both the sort of anticipating it, experiencing it in the moment, and then following up on no longer receiving that benefit and that resource, be able to look at how families were reporting their economic hardship experiences were, and what any effects on emotional well-being of members of the household were. So we were able to really map very closely sort of the effect that that program of ongoing additional resources to households had on their household circumstances. And we were actually able to see that in this specific example of this additional support, that families were using the child tax credit to pay bills, to get out of debt, to put a little money aside for a rainy day, to pay for more childcare so that they could work. And that when it went away, they started experiencing higher rates of material hardship again. So it was buffering them from material hardship during that period, and that we really saw that in an increase of hardship again once they no longer ended. So I think there's just the opportunity with this sort of like this real-time kind of monitoring to understand, not from like a program evaluation perspective necessarily, but really how our families experiencing this, and what can we learn and take away from those experiences about what support we can provide again in the future.
Great. Thank you, Christy. And I think that's a really great segue into our report. And we appreciate all the questions. If there's any more questions that you weren't able to ask today, feel free to reach out to me via email. I can answer any questions that you have about the report. My email is thunter@groundworkohio.org. It's on the website. Here's a QR code to our report. We just shared a brief overview of the high-level key takeaways and highlights. So there's lots more to dig into each section. Like Christy said, there was this thing some surprising to her. There's lots of things that were surprising me, but there's also things that confirms other data that we have, or just shows that the things that we've been talking about are looking at are a problem, and we're hearing that from families as well as we are other data sources that we're looking at. You can access this report here. Also on that report, there will be a QR code if you want to look at the instrument. So if you want to see the tool that we used to ask questions, what questions we asked, that is also available in the report. We really appreciate everyone taking time to be here today. In any way that you participated, whether that be coming to the webinar, helping recruit families, whether you took the survey, and on this call today, all of that really comes together in a really nice way as we look at what our families are experiencing and children in Ohio are experiencing here in the state. We will be sending out more information about the report. The report is available live. The chat is in, the link is in the chat. The QR code is here. We'll be sending out the slides and a recording of this webinar and the report in a follow-up email as well. But we just want to thank you again, Christy, for all the work that that you guys did at the Rapid Survey Project, and everything that we did together. We're really excited to continue to look and analyze this data and continue to advance high quality early learning and healthy development strategies for children and families here in Ohio.
So nice to be with you all. Thank you.
Thank you.